Now, this genetic sequencing out of the US is quite interesting, suggesting there are two outbreaks or strains at the same time. What do we understand about that?
Well, yes, and this is why genomic surveillance is so important in terms of understanding the nature of spread, but also the lineage. So until recently, it was believed that the West African strain, which has a lower overall mortality rate, was circulating in dominance. But new information, it appears that there are these two strains mean that this could have been circulating within the population for much longer than what was previously thought. So it's a rapidly evolving situation. It is perhaps too early to draw concrete conclusions from that now, but it means that all countries need to be putting a larger effort into ensuring that people do come forward, that there is a strong public health communications campaign so that the people presenting with symptoms that, again, some of them are very similar to other diseases, so that they can get tested, and then that data can help explain what's happening with this very puzzling and atypical case of various strains of monkeypox circulating in non-endemic countries, up to 10 countries now around the world.
Yes, and the numbers seem to be growing. If there are two strains, would it suggest, or could it suggest, that it's mutated? Could it mean something different for the way it's actually being infectious?
Well, the monkeypox virus is an orthopox virus, so it tends to be more stable than, let's say, coronaviruses, which we know mutate very quickly, and now we have a large sublineage based off of Omicron itself. So while, of course, there's still possibility for variants to emerge, it's not necessarily due to that. It could be, again, just historically not being detected that there are other strains in circulation that could have been outside of Africa for some time. So I would say at this stage, we just don't know.
Yeah. Oksana, there's been, you talked about proper information, and that's quite interesting because there's been discussion around vaccines, whether people should have vaccines. Some countries have moved to immediately vaccinate all people against monkeypox. What are your thoughts about how quickly we should be jumping down that path?
Well, certainly I think it's better to reserve vaccination for really high-risk patients, those that are at highest risk of having complications. However, it would be wise of countries to also ensure that, again, there will be a portion of the population, many who have not had any type of protection against a related virus, smallpox, because we've stamped it out. So for that reason, we do have some reserve of the smallpox vaccine, a newer form as well, but these are not widely available. So countries are going to have to try and get access to these vaccines. And that's why I don't think it would be appropriate to just vaccinate everybody, because this isn't like COVID. It's harder to transmit against people. You need quite intimate skin-to-skin contact. This isn't a virus that we have any evidence would be lingering in the air for long periods of time, or would be very easy to breathe in if you're, for instance, traveling by plane or train. So I do think we'll have to coordinate globally to ensure that vaccine supplies are available. We don't want to repeat ugly mistakes of the past with hoarding, but we could really increase demand if we start using it inappropriately. I think the WHO guidance on this is right, and it should be that it's reserved for those who have are of highest risk.
Oksana, let's talk a little about COVID for a moment. The US seems to still be recording really high infection numbers. What's behind this?
Well, I think there has been renewed travel in a way that is
uncontained, let's say.
Yeah, uncontained. Yes, exactly. So that's part of it as well. And I think that many have just moved on and aren't paying attention to the numbers, particularly with the very simple interventions like face masks. These are being used a lot less. We also know that very simple interventions that we have been talking about really for now 2.5 years, which would mean that buildings, office spaces, schools, all of these places where we have high traffic, lots of public mixing, that we should have better air filtration systems, clean air. We demand clean water, but there's been no outcry really or coordinated approach to try and reduce viral transmission that way. And it would be a benefit that goes beyond just COVID, especially with flu season, other respiratory viruses as well. We could really reduce the pressure on healthcare systems in general. I think it is the fact that, the stuff that we know works. People are not necessarily being that information is not being reported. In a lot of countries, you don't have those stats available anymore. So someone would have to be really taking a lot of personal responsibility to look at their individual risk levels. So I think it's a combination of factors that lead to the fact that we're going to see those numbers continue to climb over the summer period. A lot of people who are vulnerable will be perhaps looking at, if they haven't had their fourth booster, making sure that they get those before they go away for travel. And they may consider also, if they're going to get onto crowded airplanes and make trips abroad, that whether it's a requirement or not, that they could protect themselves by wearing a face mask.
Yeah. And, the stats that do seem to be emerging, though, are the long COVID cases, which are quite concerning.
Absolutely. And the number of people who have not caught COVID once, I mean, we're talking about people now catching it a third time around. So interestingly, we do see that here in the UK, over 2 million people have reported long COVID symptoms, including in children. And the government response here in the UK has been when parents and families have written to ministers to say how much it has affected these young lives, where it is thought to be more mild in children. But again, that's not the case for everyone. The government response was very disappointing to respond to these letters addressing that they will be issuing more mental health support. And we need to make this really clear. Long COVID is not a mental health issue. It is one that isn't necessarily permanent, but it can stretch on for many months, if not years. And we still have a lot to learn about why it affects certain people in the population so much more than others. And we will have to eventually pay that cost as a society, because it will mean that some people will not be able to return to work, and that on already pressured healthcare systems all around the world will have this additional burden of dealing with patients who have post-COVID syndrome or long COVID.
Oksana, always good to get your perspective on so many issues. Thank you so much.
Thank you.